Good afternoon, everyone. Well, the accounting is in. The CBO has reported that the Republican bill pushes 24 million people out of health care, off of health coverage. This is a remarkable figure. It speaks so eloquently to the cruelty of the bill that the Speaker calls an act of mercy. I don't know if he thinks it's an act of mercy to all the people who will lose coverage, to people who will lose jobs, to the hospitals that may have to close down, especially in rural areas. I don't know if he thinks it's an act of mercy to people on opioid addiction and other addictions who are looking to Medicaid as an answer, as many of the Republican governors have spoken to. This is, okay, so they're taking 24 million people, pushing them off their coverage. And as they do so, they are implementing the biggest transfer of wealth in our history, $600 billion going from working families to the richest people and corporations in our country. So in terms of insurance coverage, it's immoral. In terms of giving money to the rich at the expense of working families, it is indecent and wrong. This bill is very bad. They're confused, the Republicans right now. Some of them are saying, discrediting the CBO, and others are glorifying pushing 24 million people off of coverage. So I hope that they would pull the bill. It's really the only decent thing to do. Numbers are important. They see the numbers. They should know how that transfers into people's lives. They are finding that out from their constituents. How can they look their constituents in the eye when they say to them, 24 million of you are no longer going to have coverage? And those of you who do have it will have less in terms of coverage at more cost to you. With that, I'm pleased to yield to the distinguished Democratic leader of the Senate. Welcome back to the House side, my colleague.
18 happy years. Or actually 14 happy years, and when we lost the majority, 4 unhappy years. Thank you very much, and I want to thank Leader Pelosi for her great words. Now, the Republican hand-picked head of CBO has confirmed what we Democrats have been saying all along. Trumpcare would be a nightmare for the American people, causing tens of millions to lose coverage and millions more seeing the costs of their health care going up. 10 years from today, if President Trump and the Republicans have their way, there would be 24 million more Americans without health insurance. A total of 58 million Americans living in this country 10 years from now will not have health coverage. That's un-American. That's wrong. Premiums for seniors will rise a whopping 20 to 25%, and co-payments and deductibles for millions more. If there was ever a war on seniors, this bill, Trumpcare, is it. The bill spends almost twice as much on tax cuts for the wealthy compared to tax credits to help older middle-class Americans afford health insurance. The rich get $592 billion in tax cuts for the richest, compared to only $361 billion for the middle class and the working class to afford health care. So when Speaker Ryan says it's an act of mercy, yeah, for those people who make over $250,000 a year, because they get big tax cuts. The only winners in this CBO report are the health insurance executives and the wealthy Americans. Everyone else gets a cold shoulder from the Republicans in Congress and from President Trump. Now, you remember when President Trump was a candidate? He said everyone will be covered and costs will go down. We now know that he had no intention of keeping either promise. Today, the nonpartisan scorekeepers have spoken clearly. Trumpcare means higher costs for less coverage. The CBO report should be a knockout blow for Republicans in Congress. They should heed this warning and turn back from their plan that would be a disaster for the country.
And at the same time, you're seeing the report that they are taking $170 billion from Medicare, shortening the life of solvency for Medicare by 3 years. So again, seniors have a lot to lose, as do all of America's families. Any questions?
What would you say to Republicans who might try to discredit the validity of the score?
Well, this is their appointed, as the distinguished leader has said, the CBO director is one who is appointed by the Republicans. The CBO report is one that the Republicans have always demanded of us when we had the majority and we would pass a law that you must have a CBO report. So as I say, they're torn. Some of them are trying to pin a rose on this report and make it sound like it's a good thing, and the others of them are trying to discredit the CBO. But it's completely wrong.
Yeah, it's a pattern that is disturbing, even alarming in this administration. When they hear something they don't like, they label it a lie. CBO is virtually unassailable. Everyone, Democrats and Republicans, whether it be George Bush, Barack Obama, or anyone else, has gone along with CBO. They appointed this person. He was supposed to be a conservative person. Unfortunately for the Republicans, he's an honest person, and they won't be able to discredit this. This report is going to resound from one end of America to the other.
Yeah, his Health and Human Services Secretary said today, we vehemently disagree with the CBO score.
And of course, he has no facts to back it up. Numbers are quite eloquent things, you know. They speak very clearly, and we all respect and have acknowledged that we need to know the numbers, the number of people affected, the amount of money that it will cost, who wins, who loses in that equation. And as I say, in Congress, they still haven't come to terms with criticizing the CBO because 24 million people losing health insurance is not a problem for them. It's an act of mercy.
I'm sure the Republicans regret that they can't fire the CBO director as easily as they fired 46 U.S. attorneys.
What about the idea here, and I want to direct this specifically, since you said this was a knockout blow, that I'd be interested to hear from both of you here.
Should be.
It seems as though that they're not making ground on getting their members to support this. It seems like this might have been a knockout blow even before the CBO.
Well, look, we should know the truth. Before we enact major legislation, we should know the truth. CBO speaks the truth. They've been speaking the truth for decades. And to try to attack CBO is simply attacking the messenger. Let them address the real issues that CBO reveals. And the reason they don't want to do it is because the report is so devastating.
And when the American people see I tell this story about a little boy in school, and he's in first grade or kindergarten. Teacher says, "What is 1 and 1?" And he says, 2. 2 and 2, 4. She said, "Good." He says, "Not good, perfect." Numbers are very eloquent. And what you can only do is project here, because we're talking about the future. But as we have all know, you really cannot go forward to write legislation unless you have the numbers and you know what you're talking about. And it's as I said to you the other day, the Speaker was the one who signed the letter insisting that we have a CBO report before we proceeded with the Affordable Care Act, which we did and we had already written for it. But when it was important then, now the Republicans are saying, oh, it's not so important now, and who's that anyway? Who's this Congressional Budget Office anyway? It's somebody appointed by the Republicans to do the numbers and to come as close as possible to what the impact will be on the American people, on their health, and on our budget. The whole purpose of all of this, Affordable Care Act and the rest, was to improve coverage, lower cost, and expand access. Affordable Care did exactly that. This does the exact reverse. It narrows coverage to the tune of 24 million people, decreases the quality of benefits according to the actuarial report in the CBO report, as well as costing more for people. So it doesn't achieve anything it sets out to do. It's a clear message to their constituents as to how it's going to affect them. Let's see if they get the message, or if once again they have a tin ear that says the only thing that really matters to us is for us to give tax cuts to the richest people in our country, and it doesn't matter to us who suffers.
Senator Schumer, can Senator McConnell get this bill passed in the Senate?
Well, if you look at how many Republicans have spoken out against the bill, and Senator Cotton is not someone I usually agree with, but he said, don't do it so fast. They're rushing this bill through. We know why they're rushing this bill through. The more exposure it gets, the less popular it becomes. And so on something is made, and by the way, rings a little hollow. Remember their criticisms of us? Read the bill. They had no time to read the bill. CBO issued its report 3 weeks before any committee voted on Affordable Care Act. And so I think Senator McConnell's going to have real difficulty. His mainstream Republicans don't like it because it cuts back on Medicaid. And remember, Medicaid is for poor people, but it's also 60% goes to people in nursing homes, and that affects not only them but their kids. You're a kid, 45 or 50, your mom or dad's in a nursing home. You could be kicked out after this bill passes. And what would you do? Maybe you have to take them at home. Maybe mom or dad has to stop working to take care of them. Maybe they have to shell out thousands of dollars out of their pockets. So it's a loser. And what about opioid coverage? So many of our Republican senators have made a campaign, justifiably, of trying to get more opioid coverage. Since Medicaid covers opioids, this is trouble there. And then you have our conservative Republican senators, Casey. You have the conservative Republican senators who think that this bill goes, too far. So Senator McConnell is got a very, very difficult job behind him, ahead of him. And he only has the bill to blame, not anything we're doing. Democrats to a person are not voting for this bill in the Senate. He's got to get the votes on his own. They asked for that when they did reconciliation, and the bill has made it extremely difficult for him to do it.
I'd just like to say, I think that the leadership in the House and the White House as well have made fools of some of our colleagues in the Congress by demanding that they write this bill in committee up all night, overnight, and all the rest of it without seeing a CBO, a Congressional Budget Office report that was imminent, was a matter of days away. Why, wouldn't you ask, why couldn't they wait a few more days so people knew what they were doing instead of going into the dark of night without any basis of knowledge of what it would cost, who would be pushed off of care, and the rest? That really was a disservice, I think, to their own members and, of course, to their own constituents as well.
And one other point, the CBO says the costs go up by, the health care costs for those on ACA goes up about $1,000 in the first year or two, then it starts going down. It does start going down, but it's almost certainly because the plans that will be offered are so skimpy that even after year one, the amount of money the average person has to pay out of his or her pocket for health care will go up, because these plans that will come out later have higher deductibles, higher co-pays, less coverage. One more. Yes, ma'am.
Campaign committees have been using this score as an issue against candidates in 2018. What do you think the political fallout will be on the health care phase in 2018 midterms?
Well, let me just say this. It's an irony of irony that the place that probably this most affect is the heart of red Trump vote areas, rural areas, poorer areas in many of the red states are most affected. If you go to states where some of our senators are running for re-election but have been won by Donald Trump, ACA all of a sudden has become popular. And that's because people realize by losing it, they're going to be in real trouble.
It is really a sad thing, because in addition to what the senator said about those who are in red states and rural America who have largely benefited from the Affordable Care Act and who are on it and will be pushed off, a lot of the benefit of the $600 billion will go to blue areas, and that's just not right. It's not right, but think of yourself as a Trump voter in West Virginia or someplace, or Kentucky, which has really done a good job with the Affordable Care Act too, and thinking I'm going to lose my coverage and they're going to give $7 million to each of the richest families in America every year instead of giving me health care. Is that what I voted for? I don't think so.
Thank you, everybody. Thank you.
Madam Leader, there are some who would argue that you lost the speakership over health care. Is Speaker Ryan taking the same risk?
Well, let me just say this. Whatever the outcome of the election was, we expanded health care for many Americans. We view the Affordable Care Act as a pillar of economic and health security for all Americans. It stands right up there, tall with Social Security, Medicare and Medicaid, and affordable health care as a right, not a privilege. I think the election was about more things. I think it was about TARP and Wall Street and the rest of that. But the fact is, if in fact it were the case, it would be well worth it. I don't think that anybody's political survival is more important than the good health of the American people.
Thank you, everybody.
Thank you.